We focus on primary prevention, although I'm hearing a lot about these conferences, and I think, thinking about how can we really encourage access to contraceptive services for youth in care who might be parenting. And I'm talking about getting them access to IUDs and implants, and I'll talk about that longer. But if we're capitalizing on an opportunity where youth really want to do better by their children, how can we say, well, let's think about, planning the next time you want to have a kid, and if that's not for a few years, let's get you a method that you can set it and forget it and don't have to worry about for at least 3 years, if not longer. I did want to, this is drawing from Emily's research. We know that, I wanted to point out that we're talking about births, and so I want to make sure we're not conflating that with pregnancies. Pregnancy rates are going to be much higher. So pregnancy rates may be 2 times higher. We're talking about children or teens that get pregnant and then decide to go and have that baby. So I just wanted to make sure that we know that sexually active teens who age out of foster care as well are less likely than youth that's still in foster care to report using condoms and birth control at all in the last year. So when we're helping youth with their transition, how can we help them to think about their contraceptive services? And I think one of the things that we think about, and this is sort of evident, is that youth are in a system with access to professionals, with training. They have a higher risk, but we're also able to access them. And when we have them, if they're voluntarily staying in care until the age of 21, we know more of them will become pregnant, but we also have access to them longer. So how can we make sure that we can support them with primary prevention first? We've already talked about a lot of the risk factors, but I just wanted to pull in a few quotes from youth themselves. So we hear from the youth that we work with that the sex education they receive is too little, too late. They want mentors who were formerly in foster care or who understand their situation that they can relate to. Some of them tell us that having goals and dreams as youth in care is just not realistic. So how can we change that dynamic for them? And then many of them say that they recognize that they do self-sabotaging of their own relationships. They try to leave like a partner before their partner leaves them, and there's a lot of challenges around healthy relationships. So one of the programs I'm going to talk about, we enhanced the healthy relationship aspect of the program, but even still, the youth had a very hard time identifying components of a healthy relationship. And I think sometimes when it comes down to it, a lot of reproductive health issues are about relationships and how we relate. They might be very fleeting relationships, but teens at this time of their lives are going through a lot of developmental changes, and I think addressing relationships is really important for them. And again, this is from the youth themselves, so we've done a lot of work with youth across the country. I have some resources that I brought put on your tables. This, I think, some of them are mentioned in the report, Help Me to Succeed, which was interviews conducted by youth in foster care. So just saying that there's a real lack of support that they perceive from youth or from the adults in their lives as well. So how can we help them? We can provide them information. We can have evidence-based programming delivered directly to youth. We can create informed adults that can answer their questions. And we can also make sure, again, that they get health services that include access to effective contraceptive care. What's wonderful about SB 528, and a lot of the stuff I'll be talking about is we're really fulfilling the promise of that, like Amy said, is that it's clear that county child welfare agencies are now authorized to provide age-appropriate information about reproductive health. So I don't think we have the name of the person who's on the hook yet, but we're getting closer to sort of encouraging people that, they don't have to put this off. So I want to talk about some work that we've been involved in for the last few years, and Amy alluded to this. We have a partnership with the American Public Human Services Associated. We were fortunate to receive funding from the Annie E. Casey Foundation. And we wanted to do 2 things. We wanted to take an evidence-based teen pregnancy prevention program. So there's a list of 31, maybe more or less, depending on whose list you're looking at. And there's 31 on the Health and Human Services website, programs for preventing teen pregnancy that have been found to change behavior related to teen pregnancy. So when I'm talking about an evidence-based teen pregnancy prevention program, I'm talking about a program that has been found to either delay the initiation of sex or increase the use of contraception. which I think is really important because I think in terms of the social sciences, teen pregnancy, while we still have a lot to learn, we have a lot of data out there about what works. So we decided we wanted to take an evidence-based program and really make it resonate better with youth in care. Right now, none of the evidence-based programs were developed specifically for youth in foster care. So we wanted to take one that had already been found. This program, Making Proud Choices, was found to delay the initiation of sex and increase condom use, and adapt it to make it more resonant. And then we also wanted to embed it into existing independent living or transitional planning programs to educate youth. So we wanted to think about how can we do systems change so that youth are able to access these programs during the course of their care. And I think system change is very hard, and we've learned a lot about it, and I think this is where our partnership with APHSA has really come in handy. So thinking about the program itself, the whole premise of the program is youth can make proud and responsible choices, making proud choices. We worked with youth themselves and national experts to identify areas to modify for youth in care. So we, again, have more information on healthy relationships. There's a trauma-informed approach that we've taken for the facilitators of this program. And we have an increased focus on contraception because this was really an HIV prevention program that focused a lot on condoms. We wanted to beef up the contraception part and have role plays. So again, as I said, the unique part about this project, I think, is that we worked with APHSA to focus on systems change. So they walked these 5 teams. So we had representatives from Alameda County, Hawaii, Minnesota, Rhode Island, and North Carolina. And every team had to have a sponsorship team. They had to have sign-off from their leadership. They had to have someone who would come to these meetings in DC who was in charge of budgetary decisions, because we really wanted to get at someone who could, if they decided this was important, could make the systems change. And I think what we found is that just allowing a space for these teams to come together and work was very transformative. They were able to learn a lot in their own communities, but also then sharing across states. They learned a lot from, I remember the Alameda County team said that they learned how much opportunity they have here in California, that they were hearing stories from some other states, and they were like, whoa, we have a much easier working environment. So you know how, like, just learning those kinds of things, it really inspired them to say, there's no reason why we can't do this. And I thought that that was very interesting. They also, went back home and had intercession work that was required, and everyone did. And what was interesting to me, and I've worked with a lot of groups who do teen pregnancy prevention, and many of them are grant funded. These teams received no funding from us. They applied for the opportunity to participate in this systems change workshops. So we paid to fly them to DC, but all of the staff time and all of the work that they did when they got home was on them. And to me, I think that really increased buy-in. There's an amazing amount of dedication on the behalf of these teams to implement. And then we also trained them on the curriculum. And I think this was a really interesting partnership and unique way to think about systems change. So we're in the middle of a process evaluation. We've learned that 88% of the participants in the program, right? So the teams went home and they thought about how can we get access to teens to deliver this evidence-based program directly to teens themselves. It's a 10-session program, 75 minutes. So it's a pretty big investment of time. But those who participated thought that it was really helpful. 84% of participants said they would recommend it to a team. 89% said it helped them learn more about STD prevention, and 88% said it helped them learn more about pregnancy prevention. Again, as I said, the team said that the cross-collaboration was the most important thing that they learned, particularly those areas that pulled together, as you said, child welfare and public health. So this gave them the space. Many of them were working on the same issues but had never met, even if they were sort of across the city from each other. That, you might have public health doing teen pregnancy prevention, and you have child welfare doing work with youth in foster care, and they wanted to address teen pregnancy prevention. So how can they align their resources so that they're working together without a lot of additional funding to do this. And I wanted to give you an example of, in Rhode Island for their independent living skills class, they had a sex ed curriculum. They pulled that out and put in this evidence-based program. So now every youth in Rhode Island who turns 16 gets a phone call from someone to do their independent living program, and this Making Pro-Choices is part of that. In Alameda County, they've created a successful partnership with Casey Family Services, so they're able to pay, the Casey Family Services is paying for facilitators to do these 10 lessons, and they're able to offer stipends to the youth. It's also been integrated in part of their independent living programs, and they offer it at different times around their county. In addition, the curriculum was submitted to the Office of Adolescent Health, which has made a big investment in teen pregnancy across the country, and this was approved as an acceptable adaptation to the curriculum. So now people who are using federal funds are able to use this curriculum and work with this population. So I think one of the things that we like to do at the national campaign is really connect players so that people in the child welfare world who are interested in teen pregnancy prevention don't have to feel like they're going at this alone. There's a whole sort of network of people who've been doing teen pregnancy prevention for years, and how can we bring this together? And I think the recent federal investment in teen pregnancy prevention has allowed for a lot of those opportunities. So just thinking about, given all of the data that we've heard today, the policy implications, and some of these should line up nicely with what Amy has already said, what can we do next? So I would really encourage people to think about how can we bring these evidence-based interventions to youth themselves. As I said, one of the risk factors we've heard before is that youth who are in foster care sort of cycling in and out tell us that they often miss the sex ed in their schools. So they might be in one school district and then go to another school district, or maybe they just weren't in school that day. So I don't think we should count on schools doing this all on their own. And how can we offer some services to youth themselves? One idea is to have, replicate the institute model that we saw nationwide here in California. How great would it be to invite counties who are interested to participate and pull together these leadership teams and really think about how can they make this a piece of their work, a piece of the services they just offer to teens. There's also other evidence-based programs. I think if we're talking about particularly high risk, there's a program that's being tested in Kern County called Power Through Choices in congregate care. So I know there's an effort to move away from congregate care, but there still is congregate care. So for those youth, can we think about another program that we can offer to them? We'll have more information about this program. They're in the middle of the evaluation right now. And they're also, it's part of a multi-state evaluation in Maryland, Oklahoma, and in Kern County. And they'll have more information about the evidence behind this program in the next couple of years. We can also consider a new delivery system, perhaps reaching youth online, or perhaps this is supplemental information. So we know we're not going to get every youth to come to a 10-session class, but is there a way that we can get them information online? What we're finding, and I think this would resonate with youth in care too, is just youth in general, young people, teens, nothing happens specifically when you turn 20. You don't all of a sudden learn about how to prevent pregnancy. Is that they're incredibly ill-informed about contraception, about where to get services, about how important it is, and just thinking about how to plan a pregnancy. Or the notion is that planning a pregnancy is for someone else. It's for someone who maybe has already gone to college. But how can we change the paradigm so that if you don't want to get pregnant, you use contraception? It's not that you use contraception if you're type A or something like that. And how can we make contraception easier for people? And reaching youth online might be one way to do that. It's great to hear about all the education of adults. What I think we're interested in learning more about is what is really working. So how can we educate all of the adults in youth's lives? I know that there's been, we keep hearing about pockets across the country of case manager trainings or social worker trainings or foster parent trainings, and what are the salient things that are working? How long do these trainings need to be? What are we expecting to be the results? That kind of thing. And again, I'm beating the drum here, but ensuring access to health services, that includes access to low maintenance methods like IUDs and Implanon. And California has one of the best healthcare delivery systems in the country, you know, with their family pack program in terms of getting teens the care that they need. And so how can we make sure that we're really doing that for youth in foster care? And if we're thinking about, I'm always struck by the high incidence of repeat teen pregnancy and teen birth. You know, why can't we make sure that at least all of those women know that there are methods out there that they can use? And perhaps they want to have another child, but we know that helping them to space their birth will allow the next birth to be healthier, will allow them to focus more on the current child, and will perhaps give them the space that they need to complete their education or start their education or whatever. As Amy mentioned, a lot of these things are hard to do with one young child. They seem almost impossible with two young children. So how can we really open up the white space for people there? We have a bunch of resources. I included some in your packet, including a nice little accordion thing that we call the pocket protector that you can give to teens. We have a young adult version with our bedsider work that has all the methods of contraception. We have this thing called It's Your Call, Make the Right Decision for You, that we really designed for case managers to work through with their youth. So the last page is something that you can tear off where they can get access to the services that they need. We have tips for foster parents about how to have this conversation because we know that they're an important group. And then again, the resource that I mentioned, From Youth for Youth. And I also should say that we are trying to improve the conversation around contraception on a national level, and today is Thanks Birth Control Day. So if you have 20 seconds, I'd encourage you to tweet out something or post something on Facebook with the hashtag Thanks Birth Control, and you can say whatever you want. You know, we just want to make sure that there's more positive information. Like, for example, I just tweeted out a picture of my son this morning and said, thanks for giving me the chance to, you know, wait to have a kid until I was ready. And if you have any more questions about any of the stuff I presented, I'm happy to talk in detail about more of the work that we do. And if you're interested in bringing an evidence-based program to your county, I'm also happy to talk about that too.